Today's issue is simple, yet serious. The proposed PPP medical colleges in Andhra Pradesh will determine who can become a doctor and who will have access to healthcare. Medical colleges are not highways or airports. They produce doctors, they treat patients, and they save lives. Under the Constitution, this responsibility rests with the state. Before discussing this further, let us first understand the scale of what actually is being proposed. Out of the 17 new medical colleges proposed in Andhra Pradesh, 7 colleges were completed during the YSRCP tenure, and the other 10 are now being planned under the public-private partnership model. This is not a pilot project. This is a structural shift in how medical education and public healthcare are being reshaped. The Chief Minister and the Health Minister repeatedly say that PPP does not mean privatization and that it is only a partnership. But we must ask, partnership for whom and at what cost? Under the proposed PPP model, the central government contributes 30%, the state government contributes another 30%, and the private partner is shown as investing the remaining 40%. In reality, the so-called private investment is often raised by mortgaging government land, government constructed buildings. Public assets are pledged and public money is spent, but the control and revenue flow to the private hands. A medical college is not an infrastructure asset or a manufacturing unit where profits are generated and shared. A medical college is a public institution that produces doctors. It shapes the future healthcare of our country. Now, look at the class impact, which is rarely spoken about honestly. In India, it is mostly the poor and middle class families who traditionally choose medical education, often by selling land, taking loans, and sacrificing everything for one child to become a doctor. Most rich families prefer arts, commerce, management, or business education, where capital and networks already exist. This PPP proposed model hits exactly the wrong section. In PPP medical colleges, apart from the limited convener quota, the private partner is allowed to charge 1 crore or more for one MBBS seat, compared to about just 2 lakh rupees in government medical college. For postgraduate seats, the fees range even higher. So this model shuts the door on the poor and middle class students, converts medical education into a privilege that only wealthy can afford, and destroys social mobility. Now consider a situation where a student pays such massive fees. He or she is pushed into lifelong financial recovery mode. Such a doctor cannot afford to work in a primary health center or a district hospital. To repay this debt, the graduate is forced into corporate hospitals and profit-driven practices. This leads to a direct and unavoidable question. Who will serve rural Andhra Pradesh? Government medical colleges produce doctors who can serve villages and public health systems, whereas debt-driven medical education produces corporate doctors, not public doctors. Another aspect that we must bring to notice is that the health minister has stated that the central government supports the PPP model for medical colleges. If that is so, then we must ask a simple question. Why does the central government not establish aims under the PPP model? Why are Kendriya Vidyalayas, which are also public institutions, never handed over to PPP? The answer is clear. Because education and healthcare are not profit centers, they're constitutional responsibilities. PPP models may work well in logistics and infrastructure, but applying it to medical education converts public duty into debt-financed business model, built on public land, public funds, but private control. So finally, all I want to say is the government of Andhra Pradesh, the Honorable Chief Minister and the Honorable Health Minister must answer to the people. The government cannot afford to take policy decision of this magnitude that penalizes the poor and the middle class, weakens rural healthcare, and shifts a constitutional responsibility into private hands. Medical education and public health are not experiments. The cost of a wrong decision will be paid by students, patients, villages, and all future generations. The people of Andhra Pradesh deserve transparency, accountability, and a public health system that serves them, not the one that burdens them.